Hello, everyone, and thank you for joining International Medical Corps for our COVID-19 Learning Series. This series comprises 5 webinars on the most critical aspects of the coronavirus pandemic. We know that you're all incredibly busy in these unprecedented days, and we really appreciate the time you're spending with us. Today's webinar is a very important topic. It will focus on personal protective equipment, or PPE, which has drawn significant interest due to the global shortages. My name is Maura Buchter, and I am the Deputy Director for Learning and Engagement at International Medical Corps. This session is being co-facilitated by my colleague Ryan Bresnahan, and Ryan is our Training and Operations Officer in our Emergency Response Unit here at International Medical Corps. Now I'd like to introduce our speakers for today's session: personal protective equipment and monitoring. We have 2 frontline medical professionals with us today to look at ongoing research in respiratory PPE and on appropriate use and reuse of PPE. Our first speaker is Zach Phillips. Zach is an emergency nurse at New York Presbyterian Hospital. He also has specialties in primary care and vascular access. He's particularly interested in disaster relief and became interested in the science behind PPE while living in West Africa during the 2016 Ebola crisis. Karen Herring is an emergency room nurse from Virginia Beach, Virginia, who specializes in emergency and disaster preparedness and response. Karen works at the Department of Homeland Security Center for Domestic Preparedness, training first responders and first receivers on how to prepare for and respond to CBRN, mass casualty events. Karen's a board-certified National Healthcare Disaster Professional and a certified hospital emergency coordinator. So we have great speakers today. We're very excited about this session. But before we get started, I'd just like to tell you a little bit about International Medical Corps. International Medical Corps is a global humanitarian organization dedicated to saving lives and relieving suffering. We were established in 1984 by volunteer doctors and nurses, and we're a nonprofit with no political or religious affiliation. We now have more than 7,000 staff members around the world, and more than 90% of these staff members are local to the countries where they're working. Our mission is to improve the quality of life through health interventions and related activities that strengthen underserved communities worldwide. With the flexibility to respond rapidly to emergencies, we offer medical services and training to people at the highest risk, always working to strengthen local healthcare systems and promote self-reliance. In alignment with our mission, International Medical Corps is responding to the COVID-19 pandemic around the world, deploying medical supplies, training health workers, setting up triage and screening sites, and more. And together we are ensuring that people receive the medical care they need while keeping our health workers safe. In the U.S. right now, International Medical Corps is increasing patient capacity at the hospitals. We're delivering training and information series for health workers, and we are ready to deploy emergency medical teams as needed. Now I'd like to turn it over to Zach Phillips for his presentation, Simplifying the Science.
Hello, everyone. Thank you for joining today. I'm really excited to talk about this. There's a lot of really interesting research out there that I'm excited to share. So today I'm going to talk a little bit about the respiratory PPE that's currently being used in COVID-19 care. That feels especially important now because, as you'll see through some of these slides, there seems to be a relative amount of mistrust that's happening amongst organizations as far as how we are supposed to protect ourselves against COVID-19 as we care for these patients. So I want to go through and discuss some of the recommendations and where some of those things come from. Here are some of my objectives. First, I want to review the debate surrounding respiratory PPE use in COVID-19. And as I mentioned, there's been a rather unprecedented mistrust, especially between healthcare professionals and leadership in terms of recommendations and a lot of different facilities approaching it in different ways. And we'll talk about why that is. Secondly, I want to provide a simplified yet scientifically accurate foundation for understanding respiratory PPE research. I think we can all agree that there is some measure of risk when it comes to taking care of patients in any setting, but it's always very important for healthcare professionals to understand what that risk is and be aware as they go in to treat those patients. So we're going to talk a little bit about the science behind that. And thirdly, and perhaps the most importantly, I want to empower healthcare professionals to determine the adequacy of their facility's respiratory PPE. When I started researching this topic, I sent out a number of messages to quite a few colleagues around the U.S. That are at some pretty prestigious institutions and asked them, how are you dealing with COVID patients as far as respiratory PPE is concerned? And somewhat unsurprisingly, I received many, many different approaches. And so, again, I just want everyone to feel safe in their institution and to be able to have some sort of research-backed approach to when they speak to their supervisors about the PPE they're being offered. So moving along, I don't think I'm going to have much time to get into this. I had initially planned to go into all these organizations and discuss a bit about what they are each contributing. I don't think we're going to have time for that. The most important, obviously, is the CDC. They're the ones issuing the overarching guidelines that most facilities are following. The only other one that I will touch on briefly is the NIAID, the National Institute of Allergy and Infectious Disease. We'll talk about them in a little bit. So where's this controversy coming from? If you have a facility that is preparing you extraordinarily well and you feel very safe, that's fantastic. However, it does seem that in recent months there's been quite a bit of confusion surrounding how should we best care for COVID-19 patients and the healthcare professionals that are taking care of them. So where is this controversy starting? It mostly has to do with the PPE guidelines that are being released. But before we talked about that, we have to bring up SARS and MERS. So if you guys remember, SARS coronavirus had an outbreak in the early 2000s, predominantly in China. And then MERS coronavirus was on around 2012, predominantly in Saudi Arabia. Both of these were, as I mentioned, novel coronaviruses at the time. And currently on the National Institute of Allergy and Infectious Disease website, they state that much of their work on COVID-19 is an expansion of its work on the MERS and SARS outbreaks. So essentially saying that these are the viruses that they're most commonly leapfrogging off of to determine how we should handle COVID-19 care. So that begs the question, what were the CDC's recommendations when taking care of SARS and MERS patients, specifically with relation to respiratory PPE? So in a document entitled and both of these documents are available currently on the CDC's website if you'd like to look them up. In a document entitled Interim Domestic Guidance on Preventing the Transmission of SARS, they said the transmission of SARS appears to occur predominantly by direct contact. However, it is also possible that SARS can be spread through the airborne route. So they recommended N95s. Also with MERS, they said and recommended to use respiratory protection at least as protective as a fit-tested N95. So for the two viruses that are most commonly compared to COVID-19, the recommendations were, in very plain language, to use N95s. So imagine the surprise and confusion when the CDC released their guidelines for the interim infection prevention of COVID-19. A couple of highlights from that document, which is current as of this morning. Put on a respirator or face mask if a respirator is not available before entry into the patient's room. Well, that's not as strongly worded as use it as least as effective as an N95. Additionally, N95 respirators should be used instead of a face mask when performing aerosol generating procedures. We'll talk a little bit about that in a moment, but that's very different. And again, when the supply chain is restored, facilities should return to the use of respirators. As a healthcare professional that's taking care of COVID-19 patients, that does not necessarily instill a dramatic level of confidence as you're going to take care of these patients, which is to say, oh, as soon as we get more, then you should go back to using them. I don't want my PPE based on the supply chain. I want it to be based on what the best practice is. Initially, as some of these supplies begin to run low, the CDC released a guidelines called the Strategies for Optimizing the Supply of N95 Respirators in Crisis. And a couple of highlights from that document, which is also currently available. The following measures are not commensurate with the current U.S. standards of care, and as a last resort, it may be necessary for healthcare professionals to use masks that have never been evaluated. So as you can see from some of these photos I've included, that's causing a lot of concern. People do not like the fact that there are seemingly unclear standards, and they're asking, well, why with some of these other viruses were there very clear recommendations for airborne precaution protection, and now with COVID-19 it would appear that that's no longer the case. There's been quite a few protests and people refusing to go into work, and even on the smaller scale, anecdotally, nurses refusing assignments and things of that nature. Since we've established that there is at least some measure of discrepancy or confusion surrounding that, the best place to start is to dig into the research. Where does the CDC get their information? As a disclaimer, there's a billion wonderful research articles out there that address exactly what we're talking about. I'm only going to be able to highlight a very broad and simple few of them, but I tried to pick ones that seem to be especially relevant or often cited in the research. But before we jump into the research, I just want to refresh our memory about the basics of respiratory PPE, N95s versus surgical masks. So again, what we're talking about with N95s versus surgical masks is essentially droplets versus airborne particles. So a droplet is anything 5 to 10 microns. An airborne particle is anything less than 5 microns. 1 micron is 1/1000th of a millimeter, but if you're like me, and that's very difficult to kind of conceptually understand, I've included a photo here that shows the typical size of a raindrop, which is 1 millimeter, and then how a droplet and an airborne particle compare to that. So on the top left of that photo, there's a 10 micrometer. The is for micron or micrometer, and the 1 is would be like an airborne sized particle. So they're both extraordinarily small, but there is a difference, and so it's important to understand that difference. Really quickly, I want to touch on aerosolizing procedures as well. That comes up a lot in the research, and that is essentially any procedure that can transition a droplet-sized particle to an airborne-sized particle. So in the healthcare setting, these are going to be things like suctioning, intubation, anything inducing cough, nebulizers, and things of that nature. We'll touch on this very briefly again in terms of mask science, but there is a ton more science behind respiratory protection than I even fathomed when I first started researching this. I, for example, did not realize that masks do not function just as like a colander. It doesn't just block particles. It actually blocks particles in multiple different ways. We won't even get into that. I just included this as an example of that. But when testing masks, there are two important things to consider in terms of how safe they are at protecting you. First is filter. That's represented by the blue arrow. That is particles that pass through the material. How effective is that membrane at stopping particles? And then fit. Of course, as you might expect, you can have an N95 and it's wonderful, but if it's gaping open at the bottom, you're not going to have much protection, and we'll touch on that a little bit when we're looking at some of the research. So with that in mind, let's move on to some of the studies. As I mentioned, these are certainly not all of the studies out there, but they are some of the most commonly referenced. For the first one, there was a study that was done in a Toronto hospital where they studied 43 nurses who came into close contact with SARS patients, provided direct care, and things of that nature. And they found a couple of really interesting things. First of all, as you might have expected, there was an 80% reduction in transmission of the disease from healthcare providers that were masked versus unmasked. But what's interesting about this is that you would assume that the N95 masked providers were at a lower risk to receive the disease. And they actually came out and said that there was not a statistically significant difference in preventing respiratory viruses. So that's an interesting finding from that. Secondly, we have a meta-analysis where they aggregated about 8,500 or so patients that were they were looking at respiratory viral transmissions. Now, of course, the coronavirus is not the same as the flu, but data suggests that they're transmitted very similarly. So a lot of COVID-19 research references influenza and other respiratory viruses. And they found that wearing N95s was not associated with a lower risk of contracting influenza or other respiratory viruses. And if you remember what we talked about with Fit and Filter, they brought up another interesting point, which was although N95 respirators can give superior protection in lab settings, right? So in a perfectly controlled environment, these masks can stop more particles. The routine use of N95 respirators seems to be less acceptable due to more significant discomfort. And they went on to talk about how N95s frequently cause headaches, and nurses and doctors and other providers don't like to wear them, and they may not wear them correctly, and actually how a properly fitted surgical mask can be more effective than an improperly fitted N95 mask. So that was a very fascinating study. Thirdly, here we just have a literature review on the Middle Eastern respiratory syndrome. And after reviewing about 7 studies in Singapore on different transmission of this, they made the point that droplets in contact alone seem to be sufficient to protect healthcare professionals, and that evidence supported droplet precautions except for aerosolizing procedures. However, and this is not on this slide, I wasn't able to add this, but in their recommendations, they went on to say it was evident that policymakers prefer to err on the side of caution and support recommendations for full protective equipment, including N95s. So the consensus of this was, there's not a lot of incontrovertible data to show that we absolutely must have airborne precautions or N95s, but we want to err on the side of caution, and we support, if we're not sure, going up a level of protection. And that's something that you see very frequently in the literature, which is there's not a ton of obvious evidence, but we want to be more safe rather than less. We're just going to touch on a few other studies that attempted to answer this question. There was another study very similar, a meta-analysis that looked at about 3,500 patients in Beijing, surgical masks versus N95s. And while they also did not find a lot of hard data to show that N95s were drastically more protective, they did make the statement that classification of droplets versus airborne is an oversimplification, talking about how these things can exist and translate back and forth. And so because of that, they said that N95s, they believe, provide superior protection and should be used in all of these procedures. Lastly, there's a literature review that some researchers out of University of Chicago, Illinois, were looking at all of this literature, about 75 different studies, and making recommendations. This is published, I think, last week, talking about what do we recommend and how should we address this debate. And one of their summary conclusions was the precautionary principle supports higher levels of respiratory protection. So again, this idea that while there is not incontrovertible evidence to support this, we need to be careful, and if we don't know, we should err on the side of caution. Thus far, we have talked only about other diseases and viruses that may be instructive in terms of how to prevent ourselves from transmission of COVID-19, but we haven't talked about COVID-19 itself, and that's obviously because it's a novel coronavirus, meaning we haven't seen it in humans before, so there have not been a ton of studies or had time to do a lot of studies that show us exactly what COVID-19 is capable of. But there are a few, and so I wanted to touch on these briefly. As a quick note, one of the things you'll see in some of these studies is that they are not, because they are so fresh and we're attempting to get these out as quickly as possible to educate, a lot of these have not been peer reviewed, which is the normal process of other scientists fact checking and determining results. So these 3 research studies in particular seem to be talked about a lot. They were all performed very similar methodology. And so essentially what they did was they, in Singapore, Hong Kong, and the University of Nebraska, they went around patients' rooms that were confirmed positive with COVID-19 and took samples from the bed and from the floor and from the windows and from the air ducts to kind of see, well, where are there traces of the virus and how far away from the patient can this virus travel? Because as you see on this photo, as I'm sure all of you as healthcare professionals are well aware, the main ingredient is gravity. So if it's droplet sized, it tends to fall within the 6 feet. And if it's aerosolized or airborne, it can just travel and waft throughout. So the results were interesting. In the Singapore study and the Hong Kong study, air samples were all negative. So all the samples that they took that were further distance away from the patient were negative. However, a little over a week ago, the University of Nebraska released this study, which was quite a bombshell at the time, and they made note of the fact that they did find positive samples in the air ducts of COVID-19 patients' rooms, leading to their recommendation that disease spread through both direct as well as indirect contact, aka airborne transmission, and they said they supported the use of airborne isolation precautions. So again, there have not been that many studies done, but there is still some conflicting research out there about whether it travels via airborne. And of course, if we can discover that it travels through the air, this debate is rather moot. We all should be using N95s all the time. Critics of the Nebraska study would say that, well, it's in the air ducts, but that doesn't necessarily mean that is a strong enough virus to infect anyone. We're not going to get into that. That is a whole other debate, but I hope that kind of whets your appetite for continuing to follow some of the interesting research that's being done. So, in conclusion, there is current lack of evidence for full-time use of airborne precautions, and the big exception to this is during aerosolizing procedures. There have not been studies that have shown that we really need to be protecting our healthcare workers with airborne alone. Thus, the use of airborne PPE is currently precautionary. If your facility is doing that, that is great. That is definitely the safest thing to do. However, the current CDC recommendations do not conflict with the research. So the CDC coming out and saying, well, wear surgical masks until you can get N95s in. While it is not the most protective option, it is not conflicted by current research. So those of us that are going to take care of COVID-19 patients with surgical masks on, that is not contraindicated by research. But probably the most important takeaway from this is that these conclusions have to be reevaluated constantly in light of ongoing research. If we are to, say, get 5 more studies like the University of Nebraska's, that could change the entire dialogue and all of the recommendations could shift overnight. So these are my many sources cited. There's many dozens out there otherwise that I'd be happy to share if anyone's interested. But I hope that was helpful and gave you a little insight into what's happening on the research front. And overall, I hope you're just inspired to stay abreast of what's happening in research and use that knowledge to make you feel safe in whatever practice you're performing. So thank you for listening, and I will send this back to Maura.
Okay, great. Thank you, Zach, for that informative presentation. Now what I would like to do is turn this over to Karen, and she is going to be continuing the discussion with a presentation on PPE and monitoring, reuse, and repurpose of PPE.
Thank you, Maura, and thank you, Zach, for a wonderful presentation. And I would like to thank everybody that is currently here with us and anybody that might be joining us in the future. Thank you for all of your hard work and your dedication during this pandemic and very difficult time in healthcare. It definitely is not done unnoticed. So thank you, everyone, for everything that you've been doing. And today, what I'm going to talk about is the hot topic of the reuse of PPE, decon procedures, repurposing of personal protective equipment, and some of the new latest research that has come out with that, which is very, very interesting. So to start, my objectives here for today, I want to discuss and understand really the impact that PPE, the lack of PPE, I should say, has made on healthcare professionals. And let's see, and then I'm going to introduce the reuse and repurposing of PPE, describe different types of cleaning and decontamination processes that have come out. Specifically for N95s, there really isn't a lot of research out there for anything else. There's a couple, but I'm really going to focus on N95s because I feel like organizations are having to lean more towards using N95s over and over and over right now. And then I'm also going to talk about some of the alternative methods that are out there for PPE, since we are lacking, I guess you would say. We have such a shortage of PPE. So what are some alternative items or methods that we could use to still be able to protect ourselves? The shortages of PPE it's something that we as healthcare providers have really never had to experience. And the different information that keeps coming out, which Zach covered here earlier, is really posing a lot of mistrust and confusion. It's making healthcare providers scared. And it's making us have to go back and look at the different types of PPE or the different items that we might have to use to protect ourselves. CDC does have guidelines. They do set out those guidelines, but that does not mean they're just guidelines. And it's up to the organization to take those guidelines and turn them into their policies and procedures. And that's why we're seeing a lot of variation along with what different organizations have access to, because it's going to come down to whatever the organization can get. Once the organization or local, once they have run out of their supply or are getting close to it, they're going to reach out to the state. And then once the state starts to run out of their PPE or their supply, then they are going to reach out to our federal partners to come in and help us. And I feel like there isn't a lot of understanding on that. So with the shortage, it starts local, and then once we at our local facility start running out, then we have to reach out and ask for help. So there's not just one easy solution to all of this. There are multiple different layers to this to be able to get different types of PPE. Along with that, there is no standard. So as you can see in the picture here, I loved this picture, there are a lot of different variations in how and what type of PPE different organizations are wearing, and that's based off of what they have access to. And CDC guidelines are going to be the minimum standard, so not the minimum guideline, I should say. And then it's up to that organization again to take it and run with it and decide how they want to protect their healthcare providers and their healthcare workers. So in this picture, and I know a lot of people across the nation are seeing different uses of PPE. So some organizations might use goggles, where others are using full face shields. You might see PAPPers, you might see cappers, you might see surgical masks, different types of N95 gowns. You can see different types of gowns that are out there, changing of scrubs. You might even see the full jumpsuit that people are using to try to protect themselves. And it's coming down to what do they have access to? What different types of PPE can they get their hands on and be able to use for their organization? So it's not that they're wrong, it's just that it's what they have access to. And I know I'm working in 3 different hospitals right now helping them, and in just those 3 hospitals, they're owned by one organization, all 3 hospitals are wearing different types of PPE. And it's based off of what they could get their hands on, what they had access to, which is very challenging for us as healthcare workers because we look on the internet, we look on social media, and we see the different variations, and it makes us think, well, maybe my organization is not taking care of me, or they're asking me to reuse equipment. That doesn't sound right because our entire lives we've been told don't reuse anything. And so hopefully with what I'm going to talk about here, it'll help ease your mind a little bit on the reuse and repurposing of PPE. With having the shortages, we have had to go out and we've had to look at different materials or different ways to be able to protect ourselves. And this is something that we have never had to do. It's very scary, and we can be very mistrusting when it comes to having to wear something different. However, Stanford University actually put out a study, and they wanted to see what different types of materials are out there that we could potentially use come worst case scenario. So if for some reason this pandemic completely drains us of all of our supplies and we are unable to get supplies into our area to be able to take care of these patients, because the patients are going to keep coming. They are not going to stop. We definitely have to protect ourselves here. So they did a look into different materials that could potentially protect healthcare workers. And in here, you can see they use 2 different types of bacteria. So with these 2 types of bacteria, this bacteria actually mimics influenza. And the way it does it is in the size of each bacterium, and then also its ability to be aerosolized. So with this bacterium, they put different masks in the different pressurized chambers, and they basically sprayed the bacteria on them to determine, what their capability of protecting a healthcare provider or somebody wearing this would be. And of course, the surgical mask was the number 1, as you can see there, because that's what it's designed for. But very interesting, number 2 there is a vacuum cleaner. And vacuum cleaner bag. And while the vacuum cleaner bag provides a great level of protection, if anyone has ever had to use one or tried to use one before, and this was in the study as well, it is incredibly difficult to try to breathe through a vacuum bag. Even, if it's cut out pieces to fit your face, it's still incredibly difficult to be able to draw air through. But looking through here, they tested several different potential materials, which is very, very interesting. One particular thing that I thought was very interesting was the difference between the antimicrobial pillowcase and then just a regular pillowcase. There really was just a slight variation, slight difference between the 2. But as you can see here, there are alternatives. So worst case scenario, if we do end up having to go to something else, if we are completely exhausted all of our resources, we do have different materials with research backing them to provide us with some sort of protection. So with the different types of equipment, we're also being asked to reuse them. And this is incredibly scary for all healthcare professionals. We are told from an infection prevention standpoint our entire professional careers, don't ever reuse, wash your hands a million times, throw everything away immediately once you come in contact with a patient. And now, faced with a pandemic with a virus that is spreading incredibly fast throughout the world, they are coming and they're telling us to reuse equipment. So that can be very challenging for healthcare providers. But with this reuse, we are focusing on protecting our healthcare providers. So we have to do something. Our resources are dwindling. They're getting to where we are having to wait months on end to get new supplies. And best case, or the best alternative for us right now, is actually having to reuse these different types of PPE. So when you have to reuse these, and I'm saying the word when because it seems like all of us are having to do this at some point, it is very important to follow your donning and doffing, or your applying, you're putting on and you're removing of this equipment. With the N95, they have found, I just read this article last night actually, and they found that there has been the virus, the COVID-19, is actually living on the outer surface of the N95 for up to 7 days. So without any intervention, if the N95 is just set aside for time or to be reused, the outer surface of the N95 is actually holding or could potentially have the virus on it, which is very scary. And that just shows us that when we're taking this off and we're putting this mask back on, it is very, very important that we are following our organization's policy and procedure. We're washing our hands, and we are ensuring that we aren't, touching any of our mucous membranes with this, and not touching the outside of the mask as much as possible. With the PPE system, that's very easy to reuse. If you're not familiar with the PPE system, it's basically, if you see hazmat, it's the individuals walking around in what people like to deem a hazmat suit. It's the hospital's version of that. And wiping down the outside of that is a good way. You can wipe it down with any sort of EPA-registered disinfectant, and just make sure that the kill time, so the amount of time to kill the virus, that you wait that long before putting that unit back into service. And the same thing with gowns and goggles, wiping down those different, wiping down the gowns, wiping down the goggles, ensuring that you are decreasing that bioburden as much as possible to be able to protect yourself whenever going to put this back on. Another thing with the reuse of equipment, we are also being asked to we're being asked to do this two different ways. We're either being asked to take these off between patients, or we are being asked to use these for extended amounts of time. So we would put on our N95 and we would wear it for a full 8 hours without taking it off. Now, the one thing that's very important with that is ensuring that if you're going into an aerosolizing procedure, to protect the outside of that N95 so it doesn't get soiled. So we are seeing anywhere from masks being put over the N95, surgical masks, or we're seeing not goggles, but full face shields, something to protect them from any splash. Now, before you go back and if you are removing this and you're not using it for the extended period of time, it is very important to check for serviceability. If for some reason the mask is not working, it's torn, it has, it's not adhering to your face appropriately, there's any moisture in it, you see any gross contamination on it, then the filtration is not going to work appropriately, and you will have to get a new device. So it's very important that we are storing these appropriately if we're removing them. They are saying you can store them either by hanging them in a nice dry area, or if you take them, and I've seen this a lot, take them and put them in a paper bag, because that's a breathable item. However, if you do that, be very cautious when removing it, because there could potentially be the virus on the outside of it. So it's very, very important, if you do that, to make sure that you are not contaminating yourself whenever it comes to putting the N95 back on. With cleaning, so there's different types of cleaning methods, and this is really, I find this incredibly exciting. All of this information has just come out over the past couple of months. We're looking at how can we reuse the materials, the PPE that we have, and be able to protect our healthcare workers. So the different types of cleaning that are out there, you can either use hydrogen peroxide misters, boiling water, UV light has been used. Just time, if you wait for the virus to run its lifespan, then it will die off on its own as well. Of course, there's varying studies out there, so you have to go above and beyond, or I would suggest going above and beyond the length of time just to ensure that the virus has died off. There's also autoclave, there's been alcohol use, different boiling things, putting your masks in microwaves, all kinds of different studies that have come out. And Stanford University, they put out this information here. So these are different types of, different ways to decontaminate your PPE. And this was specifically for the N95. And as you can see, using alcohol or 75% alcohol and chlorine-based disinfectant for 5 minutes actually degraded the filtration efficiency of the N95. So they were no longer able to use them after putting either the alcohol wipes on them or using chlorine-based products to clean them. With hydrogen peroxide misters, they are finding that they are able to turn around the masks very easily and very quickly and get them back into service by just using the mister that goes in there, and it just sprays a very fine mist that can get down into the different particles, the different layers of the N95, and neutralize the virus on the outside of it, which is very interesting. With UV light, there's been several studies on this one. The last one that I saw was from Duke University, and with the UV light, if you overextend or if you have the mask exposed to the UV light for too long of a period of time, then it actually degrades the mask down, or the elastic bands that are on the mask, which is definitely a problem because you can't get a good seal. So it's a very fine line with the UV light. However, over at Nebraska, this is what they've been using. So they will take their N95s, they put them in a bag. It's a brown paper bag. They take the brown paper bag into a area where the UV system is actually set up. They pull the bags out, hang them out, start the UV radiation going, and they're doing it for about 15 to 20 minutes. And after that time, everything is neutralized, and they are still able to use the N95s over and over again without degrading the filtration capability of it. And of course, you can see hot water is working. There's a lot of different variations on ways to do this. With the microwave, I will say, do not place your N95s in the microwave. It has been proven that it just degrades the filtration capabilities of the mask. So do not put your N95s in the microwave as a quick fix or some way to be able to clean your masks quickly, because it will not work. So in conclusion here, I just want to say protect yourself. And I know there's a lot of information that's coming out, and it just comes down to knowing what type of, or what your organization's hospital policies and procedures are. We are going to have to think outside the box. This is a pandemic, so this is a complete culture change for all of us. We are having to not only use materials that we've never used before, but we are also having to take a step back and think before we walk into a patient room, how are we going to protect ourselves? We have to think about our protection as healthcare providers, which is something we never really do. We always run into a patient room and want to provide patient care, but if we go out, if we get exposed to this virus and we get sick, then we won't be able to take care of other healthcare or other individuals seeking medical care. So it's very, very important that we stop and we take a second to put on our PPE appropriately and make sure that we are following all policies and procedures to be able to protect ourselves. Other than that, thank you everyone so much for listening to me and all the information that I had. I do want to add one resource that I found the other day, and it is called deconn95.org, and it has very simple, easy to use, just fact sheets for doing for reusing N95. So it has the different types of decon that you can use. It has the evidence-based research that backs up the different types of decon processes, as well as just easy bullet point, easy to read information, fact sheets to be able to help you decipher through all of the information that's out there. And I highly encourage all of you to look at these references that I have here, because these are also more information that's out there about the different types of decon and what is safe and what is not safe to use for the reuse of PPE. So thank you again very much, and I'm going to turn it back over to Ryan.
Great. Thank you so much, Karen, for your presentation on reuse. And especially for sharing those studies. I agree, it's so hard to imagine how we got to this point, but it's great to know that there are studies out there that are looking to guide the way forward. So thanks so much for sharing. So now we would like to use this time for any questions that our participants have on the presentation. Hosts, in addition to myself, some of our learning and development hosts have been monitoring questions throughout the webinar in order to direct them appropriately to Zach and Karen. So in the chat below, if you would like to direct a question, please do so when typing. Otherwise, we are going to direct questions according to their presentation areas. And we encourage you again, I know that this has been covered very thoroughly in the news, people's concerns all over the country, all over the globe about PPE shortages and reuse. So if you've had any questions on what you've been reading and you're looking for additional clarification, we have two subject matter experts here who are ready to take your questions. So the first question that we have says, I've seen storage in a Ziploc bag as a recommended guideline for storing N95 masks. Should this be paper instead? I'm going to direct that question to you, Karen, about storage in Ziploc bags.
The CDC's current recommendations are for any N95s to be stored in a breathable container. So if you were able to get that plastic bag, Ziploc bag, breathable, I've also seen people that have been putting them in plastic Ziploc like storage bins, or what do I want to say, like Tupperware bins, but they've been drilling holes in them. So the current recommendation from CDC is for a breathable, some sort of breathable bag to be able to restore, or I'm tripping on my words, to store your N95 in, so breathable.
Great, thank you, Karen. The next one I'm going to direct your way as well, seeing as it's on decon. So based on the current slides, based on the current studies, is there a best way to decontaminate N95s that has been established?
That is a great question, and there actually is not a best way. As of right now, the manufacturers for all the N95s, they are saying that they do not recommend doing any decontamination of the N95s. So this is all brand new research that is just coming out like within the past 2 months. Really, I should say in the past month that we're getting this information out. So the manufacturers haven't even had a chance to be able to update their policies based on the new evidence that's coming out. But the best ones that I have seen, so for cleaning, would be the use of the UV light and the use of of boiling water. I've seen that one. And then another one is the hydrogen peroxide misters. I've seen, out of all the literature that I've been reviewing, those seem to be working the best to be able to neutralize the virus, as well as be able to keep the N95's integrity.
So again, we'd like to extend our deepest thanks to both Zach and Karen for taking time out of your schedules to share your expertise, both in taking a look at the research, just for appropriate PPE use for acute respiratory infections, and on research looking at the reuse of PPE, both which we can all agree are just so topical right now. We'd also like to extend a special thanks to our colleagues in learning and development for their support on the production of this webinar.
Please join us for the next couple of webinars. This first one is on Thursday, April 9th. This is going to be the third of our nursing forum. It's going to be on isolation and quarantine. We will be joined by Monica Staples. She is the International Nurse Program Director at the Center for Global Health at Massachusetts General Hospital. And our second speaker is Lila Ullman. She's a registered nurse in the emergency department at a level 1 trauma center in Los Angeles. So two different perspectives looking at isolation and quarantine. On Monday, April 13th, we're going to have a session on medical surge with another speaker from Massachusetts General Hospital looking at how they are looking at surge capacity for COVID-19 patients, and then also from a speaker who is with the National Guard and is going to be looking at how different states are accommodating surge patients. So thank you so much again for joining us. Again, we wish our best to you, your families, and your colleagues. Please take care of yourselves, and we hope to see you on Thursday. Thanks so much. Take care.